Good morning. I'm Berks County Commissioner Christian Leinbach, and I want to welcome you to our Berks County Commissioners Board meeting for February the 11th. We're broadcasting live on BCTV, Microsoft Teams live event, Facebook, and YouTube Live. At this time, I'd like to recognize Commissioner Michael Rivera's Executive Assistant, Barbara Lopez.
Thank you, Commissioner Leinbach. Public comment will be accepted through the Q&A function. Please include your first name, last name, and municipality. Any comments without name and municipality will not be considered. Each citizen can submit one comment. Comment length is dictated by limitations of the platform being used, which are Teams Q&A, Facebook, or YouTube. The meeting comment period is limited to 30 minutes in total. Please be concise. Comments will be read during the meeting and should not be considered to be interactive dialogue with the commissioners. Any commissioner response to public comment will be done at the discretion of the commissioners.
Thank you very much, Barbara. As always, we will begin with a moment of silence, followed by a pledge to our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. As always, we are going to begin this morning with our Berks County COVID-19 data report. I want to welcome Brian Gottschall, the director of the Berks County Department of Emergency Services and the lead on the Berks County COVID-19 leadership team. Brian Gottschall.
Good morning, Commissioner. Thank you very much. Hopefully you can see my screen. Yes, as you said, this is our report for this week, February 11th. Starting off as we always do with the PA early warning dashboard from last Friday, the most current version. We continue to see downward trending indicators in all of the areas, the exception this week being emergency department visits to hospitals. We see a small upward trend, but I don't find that particularly alarming, I don't find that particularly alarming given that just a few weeks ago, following our Christmas bump, this number was at about 2.5%. So even with this slight upward tick in this last week, we're still at less than half of the emergency department visits by percentage that were COVID related. Looking at our local cases and testing data, we continue to see a downward trend in both cases as well as testing. Obviously, we'd like to see an upward trend in testing along with a downward trend in cases. That would be the best news overall, but I guess we'll take what we can get here. I also want to make note for the viewers that we've changed the slides up a little bit this week, and we're going to continue to use this format moving forward. As you know, in the past, we have been looking at the entirety of the pandemic period, going all the way back to last March, and squeezing so much data into that single slide for basically a year caused the trends to be a little bit difficult to see and things to get squished together. So we're redoing these slides now. We're still tracking it for the full year, so we have that record, but we're doing a parallel slide that just shows from the fall period to present, and that's what we'll continue to show week after week in these data reports so that you can see a little bit more detail in the data. Our first test positivity, these statistics will be a bit of a debacle for some time moving forward due to the issue that we had 2 Fridays ago where DOH dumped well over 1,000 positive cases in a single day due to the backlog of antigen testing coming out of urgent cares. So this graph becomes very hard to look at now because we have this giant spike and then this giant fall off. But again, to use your eye to imagine that was smooth through the middle in order to get rid of that information. And again, what we see here is that we're coming down off of that post-Christmas January peak, and our numbers continue to look better and better, although still not anywhere close to what we would call good for the community. Likewise, our deaths are starting to fall over. We saw that kind of steep climb through the late fall and early winter, and now we're starting to see that flatten out, and that's very good news. Our hospitals continue to see a downward trend in census. In this week, we saw a downward trend both in among total census, ICU patients, as well as patients on ventilators. All very good news. Obviously, what we'd really like to see is the bottom fall out of these numbers and have them get down to almost zero. Nothing really earth-shattering to point out in our county comparison. The numbers continue to move up and down slowly, but we continue to remain in about the same place as we have been over the last number of weeks in all three of the metrics that we look at here as far as tests, cases, and deaths per capita. Vaccine administration, some interesting news in the last week. We actually went down a level to 12th in the Commonwealth in the number of first doses administered, but went up 2 layers in second dose administrations to 9th. So last week, you'll remember, we were at 11th in both of those metrics. This week, we went to 12th in first dose and 9th in second dose. And that is representative of some concerning information regarding the amount of vaccine coming into the county and what has to be allocated out to get people second doses in because they've already had their first, and what that leaves left over for new first doses. All issues that we do have our eyes on, and we are trying to work with DOH to get change on, but vaccine availability continues to be a significant concern in Berks County, in Pennsylvania, and throughout the nation. Repeating the slide that we showed last week of the state vaccine map. Again, easiest way to find this, there is no simple state bit.ly or short URL. So the simplest way to find this is to go to Do Your Part Berks and click on the link that Steph makes available to allow people to easily get to the state DOH website where this vaccine locator tool is. It does show the locations on the map throughout Berks County and surrounding counties where vaccine is possible. And I emphasize that again because it doesn't mean that they have vaccine available. It means that they're a site that is approved and authorized to administer vaccine. And then our tabular data, again, this is all available through DOH, but in a very complex and complicated way. So we are trying to take this on a weekly basis and break it down in Berks County. I do want to emphasize that this shows out to what DOH calls week 8, which is actually not the current week. Week 9 is this week, but DOH does not produce the information about what specific vaccine locations get vaccine in what amounts until the very end of the week. So much like some of our other data that we report on, this will always be a week behind. This is showing most current to last week's vaccine opportunities as far as what was issued out by DOH to our local vaccine providers. And that concludes the information that I have available, Commissioner. As always, happy to answer any questions if you have any.
Brian, I do have 2. Did the State Department of Health ever explain to you that makes sense that the 3rd highest number of vaccines are for out-of-state people?
No, to be honest with you, Commissioner, we really didn't inquire about that. I think we understand the reason for that, and that is simply that the vaccine reporting numbers that we show on that slide are not where the vaccine was administered, but where the vaccine recipient reported an address. And no different than somebody from Berks County can go to Lehigh County or Lancaster County, somebody from New York, Maryland, New Jersey, wherever could come to Pennsylvania and register for vaccine at a clinic in PA. So I think that's the reason we see that number.
The other question of the total amount of vaccines delivered to those healthcare providers, Reading Hospital's 14,600. That's well above the number of employees they have. So is there any rationale to why Reading Hospital has 14,600 doses, the first vaccine, when they have about 5,000 employees in Berks County?
Well, yeah, sure. They're administering significant amounts of vaccine outside of their employees. They, Penn State, and the Community Health Center and Reading Pediatrics are our top 4 in the county, if you will, as far as vaccine doses going out the door. and they are, again, this got very confusing because everybody was doing 1A, then some folks opened up to 1B, but then the state changed the definition of 1A, which meant people started to close down the 1B and focus solely on the new 1A that included individuals 65 and over, as well as those 16 to 64 with comorbid factors. And all of those folks are receiving those doses that you see allocated out to those specific vaccine administration sites.
Thank you.
Very good. Any other comments or input? Hearing none, we'll move to Commissioner Kevin Barnhart to provide his county co-wellness report. Kevin?
Good morning and thank you to Commissioner Leinbach and everyone who has joined us. Our contact tracing update from Cook County Wellness for the prior week, February 3rd to February 10th. There have been 407 new contacts with a success rate of 298, which is 73.3. So that seems like it's ticking up a little bit. And they continue to work on the people who they did not reach. They don't take one hang up and quit. So they continue to try to bring in the folks who need to be contact traced. Total since inception back in the middle of June, 8,198 contacts have been reached. And to keep things into perspective, from June 3rd to November 4th, there were 2,806 contacts listed in SharePoint. Now, just from November 5th to February 3rd, there are 5,383. And this is not unusual. This is about a week-to-week average. The week of February 3rd to the 10th, they received 30 line lists for exposure to various locations throughout the county, schools, K through 12, colleges, universities, sports teams, workplaces, daycares, etc. So it's out there. It's very critically important that we all do the measures we've been utilizing since March of last year to keep everyone safe. Thank you, Commissioner Leinbach. Back to you.
Thank you very much, Commissioner Barnhart. We will move forward with our agenda. Are there any additions or corrections for the February 4th Commissioner meeting minutes or the February 9th operation meeting minutes? Hearing none, the minutes will stand approved as presented. We did have 3 executive sessions since our last Commissioners meeting. February the 4th on litigation, February the 5th on litigation, February the 10th on personnel, real estate, and litigation. Barbara Lopez, are there any public comments on specific agenda items?
No, they're not.
Thank you, Barbara. Moving into the agenda, item 1, enactment of a county ordinance. An ordinance of the Board of Commissioners of the County of Berks authorizing and directing incurring of non-electoral debt through the issuance of 2 series of general obligation notes of the county in aggregate principal amount not to exceed $30,500,000, designated generally as County of Berks, Pennsylvania general obligation notes. I'm not going to continue to read, but at this time want to recognize Michael Vinn from S&L Solutions, affiliated with Stevens and Lee, to explain the reason for and the importance of this refinancing.
Good morning, Commissioners. Thank you for the opportunity. What you have before you for your consideration is an ordinance similar to what we have done in the past. Working with your budget and finance office, we're constantly monitoring the county's outstanding debt portfolio to take advantage of potential opportunities as they arise as market moves. And because of specifically the COVID pandemic, rates have dropped precipitously to near or at historic lows. And based on where your call dates are on some of your debt, there is an opportunity to refinance that debt and save some, realize some significant savings. So what we have for your consideration are 2 series of notes that would refinance 3 pieces of outstanding debt: the 2010B bonds, the 2016 bonds, as well as the 2015 bonds. And the reason we have to do it in 2 separate series is one's tax exempt and one's taxable, just because of federal tax restrictions. The net effect to the county would be a savings over the life of a little over $1.6 million. We would not be extending the debt. It would be simply a higher interest rate and replacing with a lower interest rate and refinancing that. Because of the way we are structuring this, if the county were to move forward with this, we could be in a position to lock in these rates and savings as quickly as potentially today, this afternoon. It's, again, just taking advantage of the current market rates, and I'd be happy to answer any questions that you have.
Thank you, Michael. Any questions for Michael?
So the takeaway is the refinancing will save the county long-term $1.6 million.
That is correct,
Right.
Commissioner Barnhart.
Thank you.
I think it's beneficial for the public to understand that, number one, Michael Vinn is the Berks County financial advisor and has been for most of the last 13 years. And one of the roles that Michael plays is to watch opportunities for savings relative to debt or overall county finances. He works very closely with our CFO, Bob Patrizio, and Michael and Bob discussed this. I believe it was last week, Michael, where you brought this to Bob's attention. And as you both put it to the commissioners, this is a no-brainer. We need to move forward with it. It saves us money. And you also noted we're not talking about generating more debt. We're simply saving money by going from a higher interest rate to a lower interest rate. So thank you for your continued work and dedication to Berks County.
I appreciate it. Thank you.
Since this is an ordinance, I would accept a motion to approve.
So moved.
I'll second.
The motion has been made and seconded to approve a county ordinance 01.2021. Is there any discussion?
Not on my part, but there is an item in the questions here in reference to that. So, okay.
Okay, then let's not vote. I didn't know what it was in reference to. I was going to go to Barbara. Let's wait to vote. And Barbara, would you please read that comment? And if there's anything we can answer or follow up on, we will before we actually vote on this item.
Sure. It's from Jess Royer in Spring Township. The very first agenda item, ordinance 01/2021, what specific costs or expenses in this ordinance is this ordinance intended to fund?
Yeah, and again, I think Michael explained that it isn't. This is old debt that is being refinanced. This is not a new issuance to fund some project. And these are tied, there are three different issues, I believe, tied to a variety of past projects. Is that correct, Michael?
That is correct. Bob actually has, we internally we have a breakdown of all of the old, what the debt was used for, because some of these were refunding before this particular issue as well. But you're absolutely right. There is absolutely no new projects being funded with this. We're not extending the debt. We're simply replacing the current interest rate with a lower interest rate.
Very good.
And just to clarify as well, the savings is net of the cost, correct?
That is correct, Commissioner Rivera. Every time we quote something, it would be net of all costs, but that is a good point to bring up. That a little over $1.6 million savings is net of everything.
Thank you.
That goes to the bottom line of the general fund and benefits Berks County taxpayers. Very good. Thank you. If you can have somebody has some background noise, if you could please mute. We'll move on to the agenda. Item 2, authorizing under that Budget Department, adopt a resolution authorizing 2021 budget transfers in the amount of $28,340 per listing dated February the 8th of 2021. There are several items listed under the commissioners. Item A, adopt a resolution authorizing the appointment of Deborah L. Millman, Esquire, VP of Development, Greater Reading Chamber Alliance, to the Berks County Workforce Development Board for a replacement term beginning March 1st of 2021 to June 30th of 2022. Item B, adopt a resolution authorizing the appointment of Karen A. Campbell, PhD, Provost and Senior Vice President for Academic Affairs, Albright College, to the Berks County Workforce Development Board for a replacement term beginning March 1st of 2021 to June 30th of 2021. Item C, adopt a resolution authorizing execution of attachment 2-hazardous material emergency response report certifications for the hazardous material emergency response preparedness report for reporting year 2020. Item D, adopt a resolution ratifying, confirming, and approving execution by the Berks County Board of Commissioners of a letter of support to iLead Inc. for the iLead Youth Build program that provides 17 to 24-year-old Reading youth with the opportunity to learn academics, job readiness, and occupational skills to make successful transitions into post-secondary education, the construction industry, and other high-growth occupational sectors. Item E, adopt a resolution approving and authorizing Alan D. Piper, Transportation Planner, to electronically execute letter of amendment to the General Reimbursement Agreement for Federal Aid Projects between the Pennsylvania Department of Transportation and the County of Berks for the Glendale Bridge Replacement Project, County Bridge 43A, Douglas Township. This amendment increases the total project cost from $648,597.59 to $2,298,597.59 to incorporate the cost for construction into the overall funding for this project. The Berks County share of this project remains unchanged at $298,613.90. All other terms and conditions of the original agreement and letter of amendment, which are not being modified by this letter of amendment, remain in full force and effect. Item F, adopt a resolution authorizing execution of the 2020 report of county fee for local use funds. Item G, adopt a resolution authorizing Kevin S. Barnhart, Vice Chair, to execute the 2020 through 2021 Pelican Loss Prevention Grant Program application. Item 3, a motion authorizing execution of contract agreements and amendments is furnished by the contract coordinator as set forth on the attached listing dated February the 9th of 2021. There are a total of 10 contracts. There are 2 with the Berks County Residential Center, 2 with CareerLink, 4 with Children and Youth Services, 1 with the Controller's Office, and 1 with Facilities and Operations. Item 4, a motion to ratify and confirm payments is set forth in the Controller's Office voucher listing dated February the 9th of 2021, and the payment of electronic transfers and employee payroll.
Commissioner Lineback, I believe we need to vote on the ordinance. I don't think we
You know
actually.
what? That's a good point. I jumped past that. So, and that's fine. That is the motion that is on the floor. Is there any further discussion on the motion to approve the ordinance?
You just added a lot to it afterwards, that's all.
Well, we're separating it. So,
The motion
all
was-
those in favor signify by saying aye.
Aye.
Aye. Opposed. The motion is carried. And
Okay.
now a motion on the balance of the agenda.
Similar motion to approve the agenda items as presented.
Second.
The motion has been made and seconded to approve the agenda or the balance of the agenda. Is there any discussion? Hearing none. All those in favor signify by saying aye.
Aye.
Aye. Opposed? The motion is carried. We'll turn now to our Berks County Treasurer, Dennis Adams, for the Treasurer's Report.
Good morning.
Good morning.
I hope everybody's enjoying the snow. We had an opening balance today of $170,308,623.47. A balance to clear of $4,313,724.01, leaving us with a balance today of $165,994,899.46.
Thank you very much. We'll turn now to our county controller, Sandy Graffius, with the controller's report.
Good morning. Okay, we had total accounts payable of $5,082,642.03. We had a supplemental payroll. I just want to mention what a great job Tina Dry in our payroll department is doing getting the new module implemented for payroll. It is a massive, massive thing, and she's working hours and hours, and she's really doing a good job. So I want to give a shout out to Tina Dry. Combined payroll for the supplement is $25,605.07 for a grand total of $5,108,247.10.
Thank you very much. We will skip the Chief Administrative Officer's report and go right to Commissioner.
Here.
Oh, you are here.
I'm here, but I unfortunately don't have anything to report at this time. Thank you.
Okay. Thank you very much. Good to see you, Ron. We'll turn now to Commissioner Kevin Barnhart for his report.
I have nothing to offer this time. I do have an answer to one of the questions that's on our live stream, so I'll wait till that period of time. Thank you.
Very good. Commissioner Michael Rivera.
Yes, thank you, Commissioner Leinbach. Just a few things very briefly in reference to business assistance. The second round of PPP loans has started, and there's money set aside for the second draw of PPP loans to eligible borrowers with 10 employees or less, or 250,000 or for loans of 250,000 or less to eligible borrowers in low or moderate income neighborhoods. So if you're a business and you're struggling and you need the PPP loan, that has opened up again for either first or second draw. So you can get more information at sba.gov, or you can go directly to your lender as well, and they will have more information on that. Also glad to announce that Senate Bill 109 did pass and was signed by the governor. Berks County will be getting almost $4.8 million in grant money to help businesses in the hospitality industry, such as hotels, restaurants, bars, taverns, and so forth. Grant amounts will be between $5,000 and $50,000. We'll be receiving this money end of February, so we expect that the application process will begin sometime in March. So please reach out to the local businesses in the hospitality industry that you know. There will be more information posted as it comes on doyourpartberks.com. So make sure that they are looking out for that information. And just to recap, if you know someone that needs rental assistance, please have them reach out to the Berks Coalition to End Homelessness at 610-372-7222. Again, 610-372-7222. Thank you.
Thank you very much, Commissioner Rivera. I have a couple items I want to share. First of all, a little over a week and a half ago, I was tagged on my social media by a report called here'stheevidence.com, and I'm not going to mention the individuals that tagged me. They specifically pointed to proof in this report that Berks County supposedly was involved in voter fraud. And the site, this is the comment, and this site looks at Pennsylvania, Michigan, Arizona, etc., and is making the claims that this is the evidence of massive voter fraud. I didn't jump in and look at the other stuff. I looked at what was specifically noted to me, and that is that Berks County was filling out and submitting new ballots on November the 16th. What this is a screenshot from the Shore system. And if you look at these, this is a military ballot. This is a federal ballot. This happens to be Chester County. This is a civilian overseas ballot. And what this is are ballots that have nothing to do with the new mail-in ballots. These are traditional absentee ballots. They had to be in our offices no later than November the 10th under the law. All of these were. We ultimately, as a Board of Elections, on November the 12th, had to vote to process these. And then on November 16th, all the information was put into the SURE system in one day. There's nothing illegal here. There's no voter fraud here. And my response back to the individual that posted was, please do your research before you post this kind of stuff. And if this is a website to go to get evidence of massive voter fraud, if they missed this, what else did they miss? Very frustrating to see this kind of stuff up and have Berks County called out when in reality, the county absolutely did nothing wrong. I'm going to close that screen, take it back to myself, and touch on one other item. I just want to give an update. All three commissioners, right before this meeting, participated on a call with PennDOT Secretary Granger. It was hosted by State Senator Judy Schwenk. We had both Republican and Democrat members of the Berks County Legislative Delegation on, and we were talking about the passenger rail studies, both the PennDOT study, the local study here done by the Berks Alliance. I just want to give a quick update on where we are. Last week at the operations meeting, the Berks County Commissioners voted to endorse the formation of a tri-county passenger rail committee. The counties would be Montgomery, Chester, and Berks. We also endorsed that there will be 3 voting members from Berks County, that each county will be able to bring in their own technical members. The only ones voting on this committee would be the 3 members approved by Berks County. The purpose of the committee is to ultimately vet the passenger rail strategy or strategies that are out there, and to determine next step and recommend action to the counties that they represent. This committee has no taxing authority, has no authority to act independently. That would take the formation of an actual tri-county authority, and we're not at that point at this time. There is a meeting scheduled among the 3 counties for February the 22nd, at which point all 3 counties will make their wishes known in supporting a tri-county passenger rail committee. The committee itself ultimately will organize and determine who will chair, vice chair, secretary, and finalize the objectives. It is our goal as a participating county to be extremely transparent in the entire process. Prior studies, and I don't want to be cautious here, I'm not being critical of anyone, but for the most part, those studies took place behind closed doors and didn't see the light of day until the study was done and said, you need to do this, 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 and this. The most recent study, Commissioner Barnhart will remember well, recommended that in order to raise capital funds, Route 422 would be tolled. And so before that study even was made public, that information leaked out. All 3 delegations, Montgomery, Berks, Chester, came out in opposition to the tolling of 422, and it died. I'm not suggesting we're even looking at that kind of a model, but I don't think the tolling of 422 would have gotten any traction if the process had been open and transparent to the media, to the public. And so that's what we intend to do, to be open and transparent each step of the way. And to that end, I wanted to provide an update to everyone this morning. That ends my comments. We'll look any comments from our row officers. Hearing no, oh, Sandy Graffius. Go ahead, Sandy.
I just want to tell you that the reason Reading Hospital's numbers are what they are is because they are reaching out to clients that go to the hospital on their My Account, and they're getting messages that they can sign up for shots at the different satellite locations of Reading Hospital. I got a message from them several weeks ago and was able to go online and select the exact day and date that I wanted and time. And I got my first shot and I'm scheduled right away for my second shot. So they're reaching out to people that have been to the Reading Hospital and are a certain age and are on their rolls.
Sandy, I didn't think you qualified. Aren't you too young?
You are such a treasure.
So thank you for sharing that. The Tower Health My Chart is how they are reaching out to people that qualify in that 1A category. If there are no other comments, I'm going to turn the meeting over to Barbara Lopez to read public comments. Barbara?
Okay. Fred Zengraf Sr., Berkshire Heights. Greetings, commissioners. A free and fair November 3rd, 2020 election would have continued and improved upon President Donald Trump's accomplishments, some of which are the following. Before the Chinese Communist Party virus invaded our shores, we built the world's most prosperous economy. America gained 7 million new jobs, more than three times government experts' projections. Middle-class family income increased nearly $6,000, more than 5 times the gains during the entire previous administration. The unemployment rate reached 3.5%, the lowest in a half century. This is a very small part of the January 2021 White House Showcase list. The current administration policies will have a negative impact on these positive accomplishments to the detriment of us, our children and grandchildren. In every election, all parties should know the ground rules well ahead of time. Just like in financial systems, there must be standardized internal controls to rule out any possibility of illegal conduct. There can be no ambiguity. There can be no opportunity for counties to handle matters differently. There must be clearly defined rules and uniformity across the Commonwealth. To change the rules during the race and even until the votes have already been counted is wrong and undermines the election process. That is what happened in the past election. That is why faith in the election system has been shaken for many. Copied from the January 1921 letter to the 2 PA legislative leaders from numerous county commissioners of PA, including Berks County Commissioners Leinbach and Rivera, the previous paragraph I could not agree with more, as well as the entire content of the letter, and appreciate the effort to address the travesty of the November 3rd, 2020 fraudulent election. Keep up the good fight for free and fair elections. Thank you and Godspeed. Wayne Lesher, Burnville. Regarding a county health department, the COVID pandemic highlights that having a county health department with the authority to place more restrictions on the county above what Governor Wolf has done, as noted in the Reading Eagle, is stunning. All local business or house of worship would shudder at the possibility. William Mulgrew of Greenwich Township. I personally thank Commissioners Leinbach, Rivera, and Barnhart for keeping Berks County an affordable place to live. I grew up near the city of Philadelphia and was smart enough to marry a country girl from Berks County who persuaded me, a city boy, to move out here. Berks and 60 other counties do not have health departments, and I'm not aware why we are less healthy than anyone else. Dr. Anthony Fauci is claiming that our children should be guinea pigs for an untested vaccine, even though medical science has overwhelmingly shown that they're the least affected by COVID-19. That undermines my confidence in government hired experts. Thank you again for common sense leadership that helps low-income families against bureaucrat do-gooders. Linda Brancandora, Bern Township. Good morning. Please bring back the verbal prayers before your meetings. I am offended by the moment of silence. We need God back in our lives more than ever, and we must show him that we truly need him. Dear Lord, please hear our plea. Amen. John Archer, Spring Township. Just wanted to mention my appreciation and thanks to Brian Gashaw for his detailed descriptions, analysis, and professionalism in addressing our county's COVID-19 virus problem. His assessment of how well Berks County has fared relative to other counties helps demonstrate some confidence in the manner that Berks County is dealing with this pandemic. Crystal Kowalski, Why Missing? Good morning, commissioners. I have been tracking daily jail logs for almost 2 years. Last week, something odd happened. There was a sudden and precipitous drop in admissions. For the 5-day period from January 30th to February 3rd, there were only 13 admissions, 24 discharges, and no parole violations. That is down from 44 admissions, 39 discharges, and 9 county parole violations for the same period the week before. The February 4th jail log returns us to what has become normal pandemic practice: 11 admissions, 15 discharges, and 3 parole violations. Would you be able to give insight as to why admissions, discharges, and jailings for parole violations dropped so dramatically during the 5-day period? As a follow-up to last week, I would like to share that the judge in Jenny Louise Cudd's case did grant her request to travel to Mexico on vacation prior to her trial. Let's remember that she was released on her own recognizance after invading the U.S. Capitol. Also last week in Texas, a man named Preston Cheney died of COVID in the Harris County Jail. He had been there for 3 months awaiting trial because he could not afford a $100 bail. Examples like these are endless. Where is the justice? Thank you, Crystal Kowalski. Jess Royer, Spring Township. Good morning, commissioners. I wanted to thank you again for your work on the issue of passenger rail. This is a long process, but Berks County residents will benefit from the eventual restoration of passenger trains. I ask that you apply the same forward-looking approach to the formation of a health department, and I acknowledge that you may be doing work on this behind the scenes. Since this issue has been covered by the Reading Eagle and WFMZ, many and more residents have been realizing that there is a core governmental function and of ensuring the general welfare of the population that we are lacking. Thank you. And that is the last comment on the Q&A.
Thank you very much. We will close comments at this time. I'm going to address one item on the issue of election reform. The election reform efforts are moving forward in the Commonwealth of Pennsylvania. I've shared this before, but I will reiterate it. The County Commissioners Association continues to meet with legislators in both parties in Harrisburg to discuss our 2021 initiatives. The #1 initiative for CCAP is election reform and election integrity. To that end, a statewide election reform task force has been put together. I believe there are a total of 6 county leaders that are a member of that, and then there are a number of other people from across a broad spectrum. The chair of that committee is Montgomery County Commissioner Ken Lawrence, and the vice chair is Snyder County Commissioner Joe Kantz. Joe is a very good friend of both Commissioner Barnhart and myself. I think Commissioner Rivera has been able to meet him once or twice. Joe's been very active for years with the County Commissioners Association of Pennsylvania, and Joe, frankly, was one of the key authors of the letter that our GOP caucus county leaders signed to the state legislature, the GOP leadership in the House and the Senate. Much of what we were calling for is consistent with the kinds of reforms that are needed. There's no mention in the op-ed piece I wrote or within the documents of the County Commissioners Association or the GOP County Caucus about massive voter fraud. It is specific to Pennsylvania, and it's specific to a need of verifiable, consistently applied rules, whether we're talking about pre-canvassing, if we're talking about curing of ballots, we're talking about drop boxes, we're talking about deadlines. All of these aspects we believe need to be addressed with clarity by the legislature. One last thing I want to touch on election reform, that I think there's a lot of confusion about my comments on the constitutionality of Act 77. I pointed this out before, but I will reiterate. Absentee ballots are part of the Pennsylvania Constitution. I believe it is Article 7, Section 14 of the PA Constitution. If you read that section, you will understand that absentee ballots are mail-in ballots. And it is my belief, and several constitutional experts believe, that mail-in ballots, which are in essence absentee ballots, in order to properly put them in place as an alternative for Pennsylvania, it should have taken place as an amendment to the Pennsylvania Constitution, changing the reason an absentee ballot can be chosen. Right now, an absentee ballot requires a specific excuse, being out of town on work, illness, that makes it impossible for a person to go to the polls on election day. I've seen a lot of people comment to me saying, Commissioner, this was needed for COVID. Well, Act 77 was passed in October of 2019 before there was any knowledge of COVID-19 even existing. The discussion on COVID didn't really begin with any seriousness until later in December of 19, and then obviously into the beginning of 2020. I believe that there is an effort to look at amending the Pennsylvania Constitution. I think that's the proper process that allows for a vetting. It would require an amendment to pass in 2 consecutive sessions of the state legislature and then ultimately voted on by the public. So that is the basis of my comment in arguing that Act 77 was not properly, mail-in ballots were not properly handled. It should have been a constitutional amendment and not legislation. Hopefully that clears up some of the questions that people had on the election reform issue. I'll turn it over to my colleagues. Any comments from my colleagues?
Yes, I do have a response to Krista Kowalski's question about the downturn in admissions at the jail. That was definitely as a result of the snowstorm, the 18 to 24-inch snowstorm, as well as adult probation officers not out on the street Monday, Tuesday, and into Wednesday, picking up people who are violating parole. That's a aberration. Certainly people were home probably hopefully shoveling their neighbors out and not committing crimes. Response to Jess Royer, yes, this weekend I spent considerable time going through documents from the Department of Health in the state, how you create a county health department, how you go about doing that. One of the interesting things in the law is if you already have an existing Board of Health, like the city of Reading has, how do you work with, or do you remove that Board of Health? Does the city council have to abolish the Board of Health if there's then a larger function as a county health department? And I would say that although Reading has 24% of the population in Berks County, I would dare say that the health needs of the community are much greater in Reading than they are in the surrounding suburbs and the rural areas. So that would be an interesting discussion to have with city leadership if we would go down that path, would be what happens to your Board of Health. And just a snarky comment, I'm just curious what they've been doing the last year. Thank you.
I want to recognize, and thank you, Commissioner Barnhart. I want to recognize Brian Gottschall. He has some additional information that he'd like to touch on. Brian.
Thanks, Commissioner. Just wanted to make sure to mention before the end of the meeting that we're going to be doing another pop-up COVID testing site in Berks County. A couple cautions. This is exactly like the testing site that was done at the Municipal Stadium back in October that was very well received. We got some good positive comments about the additional accessibility of testing in the community. This is being provided by Pennsylvania Department of Health. It's a program that they're rotating around through all of the counties in the Commonwealth, and essentially our turn was up again. We are going to be doing it at a different location this time. As is on the screen, it's going to be at the Temple Oheb Shalom. That is on Warwick Drive in Wyomissing. For those not familiar with the area, it's 1 block off of State Hill Road, directly behind the Rite Aid, kind of near Starbucks, Taco Bell type area, across from Walmart. I will caution people, this is a residential neighborhood, although it's only 1 block back off of the business district. I would ask that people please be respectful. We have a traffic plan in place. We've worked with the Wyomissing Police Department, and we don't believe that there should be a significant impact to the community. But in the event that we are wrong and that the desire to receive this testing is greater than we planned, please don't block intersections, don't block people's driveways. If you're staged on the public street waiting to get in, please keep your music turned down. You know, just generally be respectful of the fact that it is a location that folks live in, and the leadership of the synagogue was good enough to offer to host this event and make it available in a different place in the community than the last time we did this. So again, all the information's on the screen. It is at Do Your Part Berks, doyourpartberks.com, right at the top of the page after you log in, or after you click on the URL. So if you are interested in getting testing, Saturday, February 13th through Wednesday, February 17th, the site will operate 9 a.m. to 6 p.m. No appointments, just drive over, get your vehicle in line, follow the signage that's going to be there. One last thing I want to emphasize, this is not a vaccination site, it is a testing site. And we've already had people that found out about this reach out to the synagogue and inquire. We would ask that you please not reach out to them. They were good enough to help us, good enough to host this, but they're really not integrally involved in the administration of the testing process. It is a DOH testing site, so please don't bother those folks. If you do need to call somebody, call DES and ask your question of us, and we'll do our best to help you. Thank you.
Thank you very much, Brian. I'm glad you were able to share that information. Any other comments from our colleagues here?
No comments from me, Commissioner Leinbach.
Motion to adjourn.
Second.
The meeting is adjourned. Thank you.